Many think that really it is in the third world that notes could find its greatest application.
At the outset, let me thank SAGES for the honor of this podium this morning among all the dignitaries, and have nothing to disclose. In the prehistoric days, where we all lived in the one world of unified one world, surgery was practiced as a single specialty. Evil was thought to be the source of all diseases, and refining the skull was practiced at its best. The questions of why, who, and where were never the issues in the prehistoric days of one world. The Second World War seems to have divided the world politically, economically, into the first, second, and the third worlds. Each one of us belong to or live in one of these three worlds within the world. On the parallel lines, surgery evolved from the first generation laparotomy to the second generation laparoscopy to the possible third generation nodes procedures. Any emerging technology, from the idea to bench to bedside, usually takes years to decades to happen, but when it came to nodes, from idea to few animal studies and very few human cases, it's created enormous interest both among the gastroenterologists and the surgeons, and it seems to be the most happening emerging specialty. In this short span of time, there were debates regarding why it has to be done, who has to do the procedure, and even before these ongoing issues are still unsettled, we are in for another debate as to where it has to be done. Truly, it is the most controversial emerging specialty in the history of medicine, because the question of why seems to be pertinent for every technology, but the question of who and where seem to be the sole patents of nodes technology. My argument for the role of the developing world in the developing nodes is based on the genesis of nodes, the limitations of the first world, and the strengths of the third world. Take a look at this. The world acknowledges this icon for the genesis of nodes. And for the evidence regarding genesis of this icon, let us put him in the time machine, take him back to 1960s. This icon, this tiny little tot, is a third generation icon from the third world. And with this, can I say that the concept of nodes originated by the people of the third world? This concept was turned into a reality by this group from the third world, when this group showed the feasibility of a transverse appendectomy which could be safely performed in humans. So the first ever time the concept of nodes was turned into a reality by this group from the third world, and can I say that the concept turned to reality by the people of the third world? NOSCAR has laid down these key barriers to the nodes clinical practice. These are various key barriers that NOSCAR has laid down, but surprisingly, do these key barriers of nodes clinical practice differ from world to world? I'm sure they do not differ from world to world because the key barriers remain the same. So what are the additional barriers to the nodes clinical practice? The additional barriers to nodes clinical practice basically rests on any research relating to GI endoscopic surgery is based on enormous expertise on biomedical engineering, basic sciences, and clinical research, and depends on the combined efforts of the scientists, clinicians, engineers, healthcare administrators, and the funding agencies. The strengths of the third world is a conglomeration of developing countries, capitalistic countries, communist countries, very rich and very poor countries, and it has some of the best brains, beautiful people, and very rich people. Just take a look at the history of facts from the third world. The numerical system of zero started from the third world. The first medical universities started in the third world. Sanskrit is the most suitable language for the computer software. Ayurveda is the first ever school of medicine known to humans. The value of pi was first calculated from the third world, and Shushruta, the father of surgery, has performed various surgeries under anesthesia. And the place value and the decimal system were developed from the third world. And we have very rich people from the third world. And if you see a list of the Miss World title holders, 2/3 of these belong to the third world. Third world is a beautiful world. There has been a tremendous brain drain from the third world to the first world because of the pay scale structures. And this brain drain was the clinical strength of the first world, but I'm sure with the reverse brain drain that we're seeing with the changing economics in the last few years, I'm sure the third world is going to be the next knowledge superpower. Is the first world keen on notes? Yes, the first world is very keen on notes because of the increasing number of publications that you see, number of presentations, increasing number of meetings, and increasing projection in the electronic print media and increasing awareness. But is notes a priority in the first world? If you look at this total spending capacity or on the healthcare depicted in this cartogram, you can see this is enormous. We have enormous fund for the healthcare funding, but surprisingly, because of the increasing aging population, majority of these funds are diverted to the healthcare needs of this aging population. And if you look at the priorities of the first world, as per the SAGES Research Delphi project, these are the 40 priorities laid down by the SAGES Research Delphi project, and I'm sure notes does not find a place in this. As far as the experimental work is concerned, the first world dominates, increasing number of publications from the first world and limited human publications from the first world. The strength of the third world is in the enormous experience that is had in the human experience, vast data from our center, 18 patients published, and over 158 procedures done in the third world, predominantly from the Latin America. So as far as the human experience is concerned, in between the worlds, the first world has limited experience, which is published, and the third world has vast experience, which is mostly unpublished. The strength of the third world rests in the population and in the clinical research, as depicted in this cartogram. There's an abundance of poor, undertreated, and doctor-trusting patients, and this tremendous government cooperation in the third world, as compared to the first world, where government bureaucracy seems to overwhelm clinical research, and just 1 in 350 is willing to participate in the clinical research as compared to the third world population. Can notes be performed outside the operating room? If Jeff has to be believed, yes, notes can be performed outside the operating room. This has very, very serious financial implications because if notes can be shifted from this high-tech operating room to the emergency room and maybe to the bedroom in the future, it's definitely going to be cheaper. And it seems to be ideal in the third world and for the population of the third world because it's going to be cheaper. I'm saying that it's going to be viable in the third world because the future of healthcare seems to be in the health or the medical tourism, and medical vacationers from the first world seek various procedures from the third world. I'm sure in the days to come, notes will also be sought by these medical vacationers who are traveling to the third world from the first world. The nationals of the first world find the third world expenses for medical services quite affordable, and medical tourists have very good cause to seek out care beyond their boundaries of the first world. If it is to be believed, the medical tourism industry would be worth almost $2 billion by 2012, and medical procedures cost almost 1/10 of what it costs in the first world. And with this, the third world seems to be the global healthcare destination in the future. And 150 years back, from the same state of Pennsylvania, Lincoln's famous address of 150 words and 10 sentences, concise to of the people, by the people, and for the people, has to be believed. 150 years later, from the same state of Pennsylvania, after these deliberations this morning about the notes procedures, can I be permitted to say that notes is of the people of the third world, level 1 evidence, by the people of the third world, level 1 evidence, and maybe for the people of the third world, maybe level 2 or level 3 evidence. With this, if I say that the third world has evolved from third world to world class, the responses could be mixed from this to this. Does the third world consider, does the first world consider the third world a threat to this? I'm sure not and should not, because we are talking about technology and not talking about terrorism when you're talking about notes. The future of notes depends on the combined strengths of the first, second, and the third worlds for a unified one world of notes. Decreased travel times across the world, faster transfer of technology, telemedicine, telerobotics, and increased human and cultural migration have led to an emerging new global medical perspective of a new global health. And it is said that global health may be a powerful bridge to the world of peace, converting the three worlds into one world and for an emerging one world of nodes. If it is to be believed, pioneers here have brought two worlds together, of SAGES and ASG together, and I'm sure the future of nodes is going to be in the one world of nodes. Thank you very much, Mr. Chairman, sir.